Well, I suppose, what does recovery mean to me? I look at that from an organisational perspective when we're talking about service provision. Recovery is different to each individual person, but when I'm talking about it from an organisational perspective, I'm talking about the culture of the organisation, ensuring that staff who work within the service have a full understanding of what recovery is, have a full understanding of a whole systems approach to the individual, and that they see the individual as a whole person, right across the spectrum of life, being family life, community life, employment, education, and so on. And that for each individual who comes in contact with our service, that the prospects of life beyond illness exist, so that we're not confined by our mental health disorder, but rather that we are seen as a whole person who can contribute to our community and to our wider society. Well, I suppose I had the misfortune of filling out the application form for the service to become part of the RE project. And when I say the misfortune, I mean it took quite a bit of paperwork to get that done. But I think it was probably one of the best pieces of work that I have undertaken. We have an excellent service in Cavan Monaghan. We're very proud of the service that we deliver. That doesn't mean to say we're perfect, but certainly being involved in the RE project has enabled us to do a lot of things that otherwise would not have been feasible. For example, we have been able to develop a peer support worker within the service before that happened with the national programme. We have been able to develop consumer panel training, fund that. We've been part of a trialogue programme, fund that in DCU. And in addition to that, we've been able to bring service users onto our area management team and onto our quality and patient safety groups. Now, without this RE project being in place, the whole thinking of the organisation wouldn't have shifted to develop those things, and the whole philosophy that underpins that wouldn't have been possible without being part of the RE project. So when you ask what has it meant, or what has it meant to us as a service, those are the type of things that has meant to us as a service. This has helped us shift from where we were to where we are today. And I suppose as part of that, we've been able to develop our own service strategy for specific to our mental health service from 2015 to 2020. And the whole philosophy of recovery underpins that. And all of the challenges of IMROC, implementing recovery through organisational change, have been hit somewhere along our service. So that's the impact that it has on a service, and that's what it has done for me, I suppose, personally as Area Director of Nursing. Well, I think one of the first things that we need to focus on is where we are now. What's happening within our service currently? What value systems underpin that service? What philosophy governs our practice? We can look at some staff within our service are very recovery orientated or working in a very holistic way, while other parts of our service are not. So the challenge for us all is, how do we make that a whole systems approach? Rather than just look at individual pockets of excellent practice or individual teams of excellent practice, how do we make that a whole systems approach? That's a major challenge for us. That's a major difficulty that we're facing, even for the likes of us who've been involved in this process for the last 3.5 years. We still have progress to make in terms of the whole systems approach. The advice that I would give is you have to kind of embrace it, go with it, look at what's happening within your service at the moment, and then see what pieces you want to gradually change. It takes time, it takes effort, and it takes considerable input from senior managers across the service to bring across that cultural change.